Hello everyone, in this video we are going to discuss about management of snake bite. How can we manage the snake bite? First of all, if we see the patients with a snake bite, then we should do it right. It is the mnemonics what should be taken as a first aid. RIGST. R for reassurance. We should reassure the patients that you are not going to die, you will live. Anxiety is the most common cause of death. I for immobilize the limbs. We should immobilize the limb using the splint or bandage. We should place the bandage just to occlude the superficial lymphatics. It should be one finger loose. And we should place the splint back and bandage above the bite mark. What should we not do? We should not cut the wound. We should not place the tourniquet. We should not squeeze. We should not soak the area. But regarding tourniquet, if it is already placed and if the patient came to the hospital with tourniquet, what should be done? We should inflate the PP cuff just above the tourniquet and release it slowly. What happens when you place the tourniquet? If you place the tourniquet tightly, then it causes the occlusions of the vessels, resulting in the edema of the distal portions, and the edema will be so big that when you release at once, there will be gush of blood flow, resulting in the systemic intoxications of the venom. We should release very slowly, and we should not cut, tourniquet, squeeze and soak. And GH, go to the hospital. We should go to the hospital where anti-snake venom is available, and we should check the signs and symptoms in the hospitals, whether it is neurotoxics or hematotoxics. Generally, Russells are renal toxic, like it causes renal failure. We have neurotoxics, common crate and cobra, and hematotoxics, vipers, Russell's vipers, and soy skull vipers. We should check the local sign symptoms and systemic sign symptoms. In local, the most important one is the fang mark. We should check the fang mark. It is generally venomous snake has two small dots 0.5 centimeter apart, but in case of crate there will be no any fang mark. And we should check the scratch mark for non-venomous. The venomous is like this and non-venomous is like this. We can see in this figure for non-venomous and venomous snake bite. And we should check the bleeding, blisters. We should measure the circumference if there is swelling to rule out the compartment syndrome. There is a risk of compartment syndrome if there is swelling. And we should check every hourly. And we should check some systemic sign symptoms like diplopia, headache, blurring of visions and all for neurotoxics. And for hepatotoxics, bleeding from the injection site, bleeding from the bite site, subconjunctival hemorrhage and all we should check that. And we can see here what to do and what not to do during the snake bite. We should stay calm, call 911 or call the hospital, take off the clothes if you are wearing, and positioning the area, and go to the emergency room. What should not do? We should not apply the tourniquet. We should not apply ice. Don't apply heat. Don't cut the affected area. Don't use the commercial available. Don't use electrical therapy. Don't use any type of lotions or ointments. We can do single breath count. We should rule out the respiratory failures by using single breath count. We should ask patient to sit down and take a deep breath and count from 1 to 10 in a single breath. If he can count up to 30, then it's normal. But in case of like neurotoxic patients with impending respiratory failures, they might count up to only 20 or 25, and we should repeat it after 15 to 30 minutes to check it is improving or deteriorating. Other test we could do is 20 minutes whole blood clotting times. We should take the blood in the test tube and keep it for the 20 minutes. If clotted, it's normal, but if the blood is not clotted, then there is risks of DIC, disseminate intravascular coagulations. Or we can do PTINR test to seek the hematotoxicity of the venom. We can do CBC, RFT. RFT is done to rule out the Russell Viper snake bite. And we should give polyvalent anti-snake venom. It is effective regarding for common krait, common cobra, soy scale viper, and Russell Viper. The indications are lymphadenopathy, tender lymph nodes, rapidly swelling, neurotoxic signs, impeding respiratory failures, hypotension, shock, arrhythmia, hyperkalemia, rhabdomyolysis. If these features are present, then we should go for anti-snake venom. Anti-snake venom is we can get this in fish powders, which will mixed with 10 ml distilled water. About 5 to 10 vial should be given at the beginning. It should be infused at the rate of 1 to 2 ml per minute. But if after infusing, if there occurs any anaphylaxis, then we should give anti-allergic. The best one is adrenaline subcutaneously 0.3 ml. Then we should wait for some time and start again anti-snake venoms. We can reduce the dose from 1 to 2 ml per minute to 0.5 ml per minute if we see any allergy. No test dose is required. We should not waste our time for giving test doses. We can give ventilations, oxygen support to the patients. If required, if serious, then you may require mechanical ventilations. We should give tetanus toxoid, gives antibiotic for gram-positive coverage like amoxicillin, amoxicillin, and clavulanic acids. We should observe the patients for 24 hours, either it is venomous or non-venomous. We should check the patient, observe and admit the patients for observations. We should check for the renal failure and the compartment syndromes. And for in case of neurotoxics, we should give atropine 0.6 mg for adults and 50 microgram per kg for children, and newstigmins 0.02 mg per kg for adults. If it is hematotoxics, then we might require fresh frozen plasma or cryoprecipitate. And that's all. Thank you.